Welcome to the School Mental Health Minute. This is a weekly webcast that focuses on mental health and school issues for children and adolescents. We'll highlight some of the newest research findings and translate the impact and implications of these findings. All this in a couple of minutes. I'm Dan Florell, and let's see what this week's study has to offer. We're featuring a journal article this week titled, "Why Do Children with ADHD Discontinue Their Medication?" The authors wanted to examine what factors influence parents to decide to discontinue ADHD medication for their child compared to parents who continued to have their child take medication. The authors found that 71% of all families reported medication side effects. These side effects included loss of appetite, sleep problems, mood changes, headaches, and stomach aches. 86% of parents reported that medication worked well to somewhat well in their child. Within a year of being prescribed medication, 21% of families had discontinued it. One common reason was due to the psychological side effects of the medication, which included irritability, depression, and personality changes. In addition, these families perceived that the medication was not effective in addressing the child's behavioral concerns. The families that discontinued also had a higher preference for counseling and more worries about the long-term impact of being on medication. Finally, the authors also found that parents that discontinued medication were much less likely to have discussed the risks and benefits of ADHD medication with their primary care provider. The takeaway is that families who discontinue medication for their child often do so due to negative psychological side effects and the belief the medication is ineffective. These issues should be thoroughly addressed with a primary care provider at the initiation of medication. Parents should be prepared to ask their provider questions about these issues when going in for the initial ADHD medication and keep an ongoing dialogue with their medical provider to ensure the medication can effectively address the child's behavioral issues. That concludes the webcast of School Mental Health Minute. Come back next week, and thanks for watching.